Hello, and welcome to another episode of the Dr&Dr podcast. Today, we have a very special guest with us. We have Dr. Roya Kohani. She is a Harvard-trained internal medicine doctor and also fellowship-trained in integrative medicine with Dr. Weil, who's a very well-known doctor in Arizona. And she has her own private practice in La Jolla, California, called RevivaMed. So we're very happy to have you with us today.
Thank you so much for having me, Dr. Kash and Dr. Roopani.
Welcome to the show.
And we thought we would have her on. There's a lot that we could discuss with her, obviously, with her specialty in integrative medicine, because hair loss can be a manifestation of all kinds of internal conditions. But today we thought we would focus on hormones and how that can relate to hair loss, and specifically focus on thyroid disorders as well as hormonal conditions like PCOS. And we thought we would start with thyroid disorders just because they're so common. And I think an important starting point would be people who think that they may have the condition or who have no idea that they have the condition. What kind of symptoms should they be looking out for that could be a warning sign that they could have a thyroid disorder?
Well, thank you so much again for having me. So thyroid is an incredibly important gland, and every cell in the body has a thyroid receptor. It's a small little butterfly-looking gland that sits right here in the neck, and it affects your energy, your cognition, your weight, the temperature control in the body. A lot of skin and hair conditions are affected by your thyroid. Metabolic issues like cholesterol and blood sugar can be affected by thyroid. So one of the most common form of thyroid dysfunction is low functioning thyroid, which we in medicine call hypothyroid. Not all forms of hypothyroid are autoimmune, but a big subset of that is autoimmune, and it affects women much more than men. I've had men in my practice who come in, and we'll talk about some of the presenting symptoms. But for example, this one gentleman in his 50s came in. His main complaint was fatigue and weight gain. And he was convinced that his testosterone is affected. And I think when patients present with a constellation of some of these symptoms like fatigue, abnormal weight gain, skin being dry, in women, they complain of hair loss, a little bit of heaviness, kind of in the middle section. It's really important to do correct testing. So some of the important tests we do include TSH, which is the thyroid stimulating hormone. We need to check free T4, free T3, thyroid peroxidase antibody, just to screen and make sure that this is not autoimmune. So just relying on a TSH testing is not adequate. Number one. Number two, the normal range for TSH has been misinterpreted quite a bit. Laboratories have different ranges of normalcy. Some call it normal up to 4.5. But most endocrine specialists, most studies have really looked at this carefully, and they recognize that TSH, once it starts going over 2.5, we need to pay attention to it. I want to spend a little time talking about TSH. Again, it's a thyroid stimulating hormone. It is not produced by the thyroid. It's actually produced by the pituitary gland, which is under the influence of hypothalamus. So that's why when we talk about how stress affects you, we're not just, talking non-scientifically. There is a true pathophysiology in there. So when the thyroid becomes lazy, when the thyroid is hypoactive, the brain is trying to wake up the thyroid. The brain is trying to tell the thyroid, come on, get up, let's start working. So that's why the TSH starts going high. So when we look at a patient and the TSH is 4.5 or 5, that means they are hypo hypothyroid. They're low functioning in thyroid. And then there are three types of hypothyroidism. There's primary, secondary, tertiary, but the majority are, primary, which is just the gland has decided to be lazy. And then autoimmune is another big subset. And then in some cases, we have patients who have had maybe radiation treatment for cancer, or they have been exposed to certain other medications, like there's a heart medication called amiodarone that can affect the function of the thyroid. So all of those need to be taken into account. But doing a good testing to start with can really help out. So again, in the case of this gentleman who had presented, we checked his testosterone, but we also checked his thyroid. And in his case, it was an easy fix. He, under tremendous stress, with work and family life, he was significantly hypothyroid. His cholesterol was abnormal. His sugar was abnormal. He was very fatigued, depressed, actually. And once we fixed the thyroid, he felt a lot better. And we can talk about, treatment options.
Yeah, absolutely. So I think what you're saying, so for any patient that you are suspecting that they may have a thyroid disorder, you're not just getting a TSH, you're typically getting TSH, free T4, T3, and the TPO antibodies, correct? Because I think what's standard or common practice among a lot of primary cares is they just do the screening TSH, and then if that's normal, that's the only testing that's done. So you're saying that's not probably adequate in most
It
cases.
just doesn't give us the big picture of what exactly is going on. And there have been cases where maybe even the TSH is normal, but patient really has what we call subclinical hypothyroidism. They have all the symptoms of a low functioning thyroid. The TSH is normal, but then when you delve a little bit deeper, then you see, no, the free T3, which is really the bioactive form of thyroid, is low. Or you start noticing, oh, there is a little bit of TPO antibody circling around. So, okay, now we have a little more tools to tell this patient what to do and how to correctly help the patient. So if the patient has had a TPO test done 6-9 months ago, I don't need to repeat it. But if they really haven't had a proper thyroid function testing done, I usually have at least those 4, and there are more tests you can do. There is reverse T3, and then there is thyroglobulin, but the minimum is those 4 tests that gives us a good picture of what's going on with the thyroid.
Okay. And this is, I guess, jumping into treatment a little bit, which I think...
Sorry,
okay,
before we go into treatment, I do have a question. So for our, folks, listeners, and even for patients that we would potentially encounter, what is your timeline for someone to be noticing these symptoms at home, right? And try to figure out what could be the correlation or causation of those things before seeking out help and then going through, a multitude of tests.
Right. So again, I think that may be why 60% of the 20 million people who truly have hypothyroidism are undetected or undiagnosed, because patients, the common symptoms are fatigue, weight gain, a little bit of depression, maybe other mood fluctuation, insomnia. Well, those are very, very non-specific symptoms, so people can blame lifestyle or the stress of life. And
I have all of those symptoms right now.
So you should definitely get your
I should get my thyroid checked.
Yeah.
Okay, so it is very underdiagnosed. Okay.
Yeah. So, and what I tell patients is that tests are tools to allow us and guide us to help you. And thank God we're living in an era where we have access to all these amazing, individualized testing, and the array of these tests are becoming more and more available. So if of course, their insurance, allows them if the and out-of-pocket cost for just thyroid is really not much. I mean, there are companies who are now doing a good job of doing a pretty detailed thyroid testing, complete, for like $75. So
Yeah.
it's really not that expensive. So I know people worry about, cost, but it's a very important test to do because if it's abnormal, there is an easy fix for it. And I have been amazed. I had a patient in her 50s, and of course, she's complaining of fatigue and she can't sleep and she has gained weight, so she's blaming it on menopause. And then last minute, she told me, yeah, and my wrist has been hurting. So I'm like, okay, is this arthritis? Is this what? And sure, I mean, I tried to do a detailed test, kind of, check thyroid and inflammation, and her thyroid was completely off. And once we corrected the thyroid, even her joint pain got better. And I was surprised. I was like, wow, I did not know that your wrist pain could be related to that. Now, of course, women are a little more vocal than men. Women, we love our hair. We want to keep it full. So the moment we notice there is a little more hair loss and the skin is dry, and yes, we're not as energetic, we go and we ask, we talk to the doctor. I think men are a little more maybe tolerant or less vocal. So,
But you do bring up a good point, or mentioned it earlier. It's whenever men think of, I feel fatigue and I'm, lethargic or tired regularly. We know what we hear on social media and different podcasts and Joe Rogan or whatever, and it's like, oh, testosterone, yeah. Right, like you lack it. And so what you're saying is it's better to get a little bit more of a comprehensive check, because it may be something as simple as, hey, you have a thyroid disorder instead, and it's not a testosterone issue.
Right. And as you said correctly, I think it's become more maybe mainstream for men to talk about possible testosterone deficiency. But to be honest with you, I really believe correcting thyroid can affect so many things. And even the testosterone production can improve if your thyroid is functioning better. I think it goes back maybe evolutionary wise. If your thyroid is functioning well, your body then thinks that, okay, my hormones of procreation and all of that can now be fine. But when the thyroid is really affected, who wants sex hormone? Right? So the body kind of goes into the mode of depressing everything. And that's why also in women, hypothyroidism sometimes causes irregular menstrual cycle, because it does affect estrogen, progesterone production. So I think it's a really, really important gland.
Now, okay, you made me think of a different question. Sorry. So I guess, you talked about like TSH of 1 to 2 or 2.5 being ideal. And so I guess you're kind of saying that, like, is there an idea of optimizing thyroid beyond, okay, yes, you have hypothyroidism or you have hyperthyroidism and you meet diagnostic criteria for a disorder and treating that, which we can talk about, but is there also this idea of like an optimal level of thyroid, or like needing to make, maybe you don't need to take medication, but needing to make lifestyle changes to have optimal thyroid health? Is that, or not?
Absolutely. No, absolutely. I think that's a perfect question, and especially in the field of functional medicine, which again I would like to practice. I do whatever I can to not give medication. That's kind of my primary goal in taking care of patients. So if I can help a patient fix their diet, avoid some of the toxins that's affecting their glands, and instead incorporate certain type of food that really supports the healthy function of the gland, and I monitor them. So let's say I have somebody with a TSH of 3.0. Okay, it's kind of borderline. All right, I'm not going to jump into maybe giving them thyroid medication right away. I'm like, okay, let's look at some of the inflammatory food that's in your diet. Let's get rid of corn. Let's limit your gluten. And I don't particularly like cow's milk, to be honest. I think there's something to be said about casein also. And we can get into this whole discussion of A1, A2 protein, the certain peptides. It may be important for your listeners to keep that in mind. This is not about lactose. So you can go get yourself lactate milk. Lactose is the sugar molecule. We're talking about casein, which is a peptide. It's a protein. So you could use A2 milk. So I would say organic A2 because that's a different peptide that may be processed a little bit better. But in general, if I have patients who have borderline thyroid, I tell them, you know what, can you go just dairy free? And I am also not a big fan of corn when it comes to thyroid. Don't ask me why, but corn is inflammatory. And I have had patients with abnormal TPO, which is a thyroid peroxidase antibody, Hashimoto thyroiditis. And I put them on no corn, no dairy, limited gluten. I know gluten-free completely is difficult, but limited. I can bring down the TPO with no medication.
Oh.
No medication. Now, there is also, you have to add selenium. And selenium is a very important element that exists in certain food, shrimp, Brazil nuts, halibut, they have shrimp, but they have selenium. You need to add iodine. And I beg patients not to go buy iodine drops because the next thing you know, they're going to overdo it and then the thyroid gets all inflamed. So just get it through your food. Food can be your best medicine. So eggs can have iodine, iodized salt, simple. So let's try to do as much as we can with food. But if I have someone, I actually again had a gentleman who came in and, weight gain and other symptoms. Interestingly, he was asking about PRP for hair growth. So he had noticed hair loss. So before we talked about, the importance of PRP, which again, you both are experts in that, I said, you know what, let's do some blood tests. So his thyroid his TSH was 60.
Wow.
I mean, I was like, how are you awake with that?
Yeah.
So again, I'm thinking, okay, could this be a pituitary adenoma or some other thing? So again, detailed testing, it turned out that, he was taking certain medication for something else and it was affecting it. In any case, he had to go on thyroid medication, bring it down. But we also did talk about his diet and I kind of digressed there. But yeah, so my point is it affects men, it affects women. The presenting symptoms can be somewhat similar, but yeah.
We go off on a tangent, but I did because this does come up a lot, and I think it'd be interesting. But dietary modification. So you mentioned corn, and practicing in California, you probably have a large Hispanic population. So I wonder if there are higher incidents of this. And the only reason I'm thinking of this is because I've been eating corn tortillas a lot lately.
Because I'm gluten free.
Because she's gluten free, and so I go out of my way to get gluten free food, and corn tortillas are a big part of our life.
Yeah.
And I love cheese, so
there you go. I know. It was like, what do I eat?
So is there a higher incidence?
I was looking at the incidence actually. So I think there was an article on in PubMed. It was a meta-analysis. So they had pulled a lot of studies from all over the world, and they had looked at the incidence of Hashimoto thyroiditis. It's pretty low in some of the Asian countries, in Vietnam, in certain parts of China. Interestingly, it was elevated in certain parts of Africa, some countries more than others. It was high in Denmark. I was surprised. And then I was like, ooh, dairy. Jeez, dairy. US, there was more of an association with socioeconomic standards, which then again affects your food intake. So more inflammatory food can cause more autoimmune issues. I honestly don't remember in the Hispanic population, especially like in Southern California, but I personally have had a number of patients, Hispanic patients with autoimmune. And again, I don't know what subset of the total population that would be. But food definitely plays a role. And what I love to, I'm a big numbers person because, you do all these lifestyle modification. How do you know it's working? There are certain labs, there are certain numbers, you just look at it. Okay, your C-reactive protein is coming down, your TPO is coming down, your TSH is normalizing. So that's the only way I can, besides the symptoms, of course, but that's a reassuring way to guide the patient.
Probably motivating for people too to keep going.
Yeah.
Yeah, so I think in terms of food and kind of lifestyle modifications, you mentioned avoiding corn, dairy, limiting gluten, right? Making sure you're getting enough iodine, making sure you're getting enough selenium.
Yeah.
And then you mentioned like a low inflammatory or anti-inflammatory diet. Are there things in particular besides the dairy and gluten that are involved in that, or what does that look like?
Sure. The anti-inflammatory diets, the general principle, we sometimes refer to the Mediterranean diet. Some people like to, do a paleo diet. There are all kinds of, but again, the premise of it is good, kind of non-starchy fiber, if you want to call it, healthy fat. So you can get your healthy fat from, certain type of fish, but not the deep sea fish because those could be high in mercury, and mercury is not good for your thyroid. So you want to, focus maybe on the halibut and on the salmon, obviously not farmed. And then nuts, healthy nuts. So walnuts are good. Brazil nuts have high selenium. So the way I give examples of healthy food, and I'm personally, I've never followed any particular diet. I think we kind of, maybe a melange of Mediterranean and paleo, whatnot. But eggs are great for breakfast. Avocado. You want to do oatmeal. Again, in Asian cultures, they eat a lot of rice. And the more I read about thyroid, the more I understand that, certain type of rice, especially basmati or jasmine rice, they're good for the gut. They're really good for the gut. So when somebody really can't tolerate gluten, I tell them, you know what, try rice. Organic meat. So it doesn't have to be necessarily beef if you're anti-beef. I'm not anti-beef. I eat beef, chicken, fish, it has to be healthy. But just make sure you have good amount of vegetables. Now, again, when it comes to thyroid, particularly cruciferous vegetables, if consumed raw, is not that great. So I would steam cruciferous vegetable. I don't say don't eat it. You want to have your Brussels sprouts and your broccoli and broccolini and all of that. Fantastic. Don't overdo it, and also steam it. And somewhere, I'm sure there's a paper that explains exactly, what's going on. We can get into that. But yeah, I do that. And then again, when it comes to autoimmune conditions in general, I really think we got to focus on the gut. I think we live in a society where there's a lot of antibiotics being used, whether in the food, that we consume, or every time something goes wrong, okay, let's, have a quick fix and use. So we're killing a lot of good bacteria. And I'm not here saying take a probiotic every single day. No, but maybe think about it. If you are using antibiotics, think that you are destroying a lot of good bacteria also. So maybe you need to replenish that for a short period of time. You don't want to take probiotics. Okay, every ancient culture you think about have fermented food. They have kimchi. We, in Persian, Indian cultures, we have been brought up with fermented food, and there's truly a wisdom in that. So I'm a big fan of that. Healing the gut has tremendous benefit in terms of reducing the whole process of inflammation, which we now recognize it affects the brain, it affects the glands, it affects everything. So, yeah, that whole anti-inflammatory premise, I think, goes a long way.
And then what other, besides, focusing on diet, are there other lifestyle changes or areas of focus that you have people work on, like exercise, sleep, or other, whatever it may be?
Absolutely. I mean, again, if we really think about the hypothalamus pituitary pathway, so good sleep is important. How do you deal with stress? Okay, you can't tell a patient don't have stress. I mean, okay, let's try to, be realistic. Everybody's going to have stress. The real question is, how do we deal with it, and how do we take care of ourselves while dealing with stress? So exercising, walking in nature. If you're into meditation, meditate, yoga, all of that. And again, some people may like to have a series of supplements, and I definitely recommend people looking into healthy supplements. I personally feel that there's so much you can get from your good nutrition that you may not need to bottle up everything in a capsule. I had a patient came to me one time. She came with a little suitcase, and I thought, oh, poor thing, she's probably headed to the airport maybe after this, or maybe she came from the airport, or who knows. She opened the suitcase, and it was full of bottles of vitamins. So she's thinking that she is so healthy that she's taking all these vitamins, and I'm thinking, oh my God, there is no space in your stomach for real food. I mean, what are that's just not healthy. So yeah, be selective. I mean, omega-3 fatty acids, if you're not getting it through your food, definitely take a supplement. If you B vitamins are really, really important for energy, right? So a lot of us, we are running around doing a zillion things, juggling parenthood and work and everything. So B vitamins are important. If you don't think you are getting it from your food, if you're not eating eggs, if you're not eating beef or organ meats and things like that, you're probably not getting enough B vitamins. Okay, then supplement. Selenium, I really think you could get it from food. You can get it from, healthy nuts and, some fish. But if you're not, maybe get a multivitamin that has a tiny little bit of that. Same thing with iodine. I don't recommend taking an iodine supplement because that can be dangerous, but make sure your salt is iodized. Make sure you, every now and then have the right seafood. Shrimp actually has iodine in it. So, so there's so much we can do with food as medicine instead of, taking a capsule for everything. So I'm a big fan of that.
Yeah, I think this has been great in terms of diet, lifestyle, and then I did want to cover like medication management a little bit and anything you had to add there.
Yeah. So the main line for prescription medications for hypothyroidism has been levothyroxine or Synthroid, which is essentially a synthetic preparation of T4. So again, if you think about the thyroid gland, it produces T4, which then has to get converted to T3. And the way I explain this to patients is that imagine you're getting crude oil, which then has to go through the factory, gets processed, become the gas that then you can put in your car. Every cell in your body will respond to T3. So our body has to convert the T4 to the T3. So if you're taking levothyroxine or Synthroid, which is T4, and it gets correctly converted to T3, perfect. That's all you need. That's why when I test, I check TSH, free T4, free T3, and then occasionally the TPO. So there have been patients that you give them levothyroxine, Synthroid, and initially they're fine, and then after a while you check and you're like, the T4 looks good, the T3 is really, really low, and they are complaining. Oh, my hair is falling again, I'm gaining weight, I'm tired, I'm depressed. So those are the patients that really need the combination. They need T4 and T3, and that can come in the form of Armour thyroid, Nature thyroid. You have to be careful in some of the older patients. Too much T3 can cause heart palpitation. In normal, healthy patients, again, if the dose is right, they feel so much better. In fact, there's cardiovascular benefit, there's metabolic benefit, cholesterol gets better, everything. And one conversion, just easy for all physicians to keep in mind, is if you have a patient who is on about 100 microgram of Synthroid, anywhere between 88 to 100 microgram of Synthroid, that's the equivalent of 1 grain of Armour thyroid, which is 60. So think of it, 100 microgram of Synthroid is equivalent to 60 of Armour. So those are the patients you may need to think about switching if they're not responding to Synthroid or levothyroxine. So those are the main kind of treatment options we have. And there have been some supplements where they use a lot of glandular products. Again, there are all kinds of thought processes out there. Some people like glandular supplements. Some people don't. I'm not a big fan of supplements that contain glands of animals. I just don't think they're regulated enough for me to trust them. I don't know if it's clean. I don't know if it's got viral infections or not. So I don't ever recommend my patients taking glandular adrenal supplements or glandular thyroid, but Armour thyroid is, by a company that goes through clean processing. So I think it's safe to say you can trust that.
Perfect. No, that's super helpful. I wanted to check if anyone else had anything else on thyroid, because I feel like we've covered a lot. It's been
Sure.
really, really helpful. But otherwise, I was going to move on to focusing more on kind of sex hormones and specifically androgens and androgen excess and conditions like PCOS.
Yeah. No, sure. Yeah.
Okay. Perfect. Yeah. So I guess we can do it kind of similar to with thyroid. So first thing would be kind of symptoms to look out for that could indicate that androgen levels or activity is high.
So PCOS is a really important endocrine condition that mostly affects young women in the reproductive age. They typically present with symptoms of excess androgen, as you correctly pointed out, which is acne on their skin, increased hair growth in most areas of the face, we call it hirsutism, and then hair loss, so in the form of alopecia. So that's a subset of symptoms related to androgen excess. PCOS is truly a metabolic condition. So a lot of these patients present with abnormal weight gain, with abnormal sugar metabolism. They have insulin resistance. Another set of symptoms that they present with is irregular cycle. So the criteria for actually diagnosing someone with PCOS is that they have to meet 2 of the 3 categories. So category 1 is irregular menstrual cycle. Category 2 is symptoms of androgen excess, which we talked about. And category 3 is actually having small cysts on their ovaries, which is diagnosed with an ultrasound. The majority of the time, if you have 2 of the 3 categories, you have the diagnosis. So sometimes you don't need the ultrasound, but sometimes it's not quite clear. But yeah, it affects a lot of young women. It's quite upsetting for them. It affects their fertility. But again, every young woman wants to have clear skin, wants to have beautiful hair. And I think especially the hair loss is really upsetting for young women. It's quite noticeable. And again, this is another one of those conditions that things can be done. So it's important for patients to recognize some of these and to go to their doctor, and hopefully the doctor can recognize and start them on, treatment options.
Yeah, no, I think a lot of my cases where it's very severe patterned hair loss or very early onset, a lot of them have been associated with PCOS. And then it's interesting too, we did a paper together on this, that there's actually evidence that the same genes and families that have PCOS in women that can present in men as male pattern hair loss. So they don't have all the other symptoms, but they have male pattern hair loss. So I thought, that's interesting too. And we know people with androgenetic alopecia or patterned hair loss are at higher risk of a lot of metabolic conditions. So like cardiovascular risk, hyperlipidemia, hypertension,
Yeah.
diabetes. Yeah. So
Diabetes, yeah.
I think there's more, not for everyone, but for a lot of people, there can be more to it than just hair, even in males, which I think is super interesting because we think of like females and PCOS, but we don't often think about male pattern hair loss and
Right.
what that could mean.
Yeah, that's very interesting. I was not aware of that.
But yeah, I think that's great in terms of symptoms. And then you mentioned kind of next step would be going to a doctor to get evaluated. Obviously, a good history in terms of symptoms would be important. I know some of my patients have their androgen levels tested, like they'll have testosterone tested. And then if they're not getting the diagnosis or if they're having abdominal pain or something like that, then they'll get the ultrasound for cysts.
Right.
Is there anything else, I guess, diagnostically that people should be aware of?
Yeah, I mean, the biomarkers in the blood, you mentioned sex hormones. So we tend to do sex hormone binding globulin, testosterone, DHEA. FSH, LH is usually disrupted, so that's what's affecting the follicles. And it seems like, and again, when they look at the pathophysiology of it, it all possibly stems from an insulin resistance underlying issue, which then leads into either overproduction of the GnRH or the follicles get stuck in certain stages. So some of those can definitely be checked in the blood. I always check hemoglobin A1C, which guides us in terms of where they are in that insulin resistance path, which then can help us figure out, okay, do we need to intervene with medication or not? Cholesterol definitely gets affected as well. But yeah, I mean, the typical ones are testosterone, estrogen, progesterone, DHEA, and again, thyroid. I always put that in there. But yeah, those are pretty important as well.
Okay, and then what about in terms of diet and lifestyle modifications specifically for PCOS?
Yeah. So is huge. I really believe that patients with PCOS can make a tremendous difference if they change their diet. And there are a few important categories in their diet that they need to pay attention to. They need to go on a low carb diet. They need to get a good amount of fiber, maybe between 28 to 30 grams of good quality, non-starchy fiber. They need good fat. So really the mono, polyunsaturated fat, healthy, again, omega-3s, get it through your diet. If you can't, okay, you want to take some fish oil, that's fine. But again, you can do it with walnuts, chia seed, hemp, there's a lot of, flax, all of that. And then there are also, there's this whole topic besides fixing the GI microbiome, which we talked about. I don't want to get into that again. But liver detox is also important. And again, I'm a big fan of using food as medicine. So I tell my patients, well, first of all, no alcohol. And for those of you out there that like your red wine, I'm like, you know what? You can substitute that with cherry juice or pomegranate juice because they are so good on your liver. And part of the reason is estrogen metabolism goes through the liver. And if you can really help some of the enzymes in the liver that deal with that, there's a phase 1, phase 2 detox pathways in the liver, if you can help with that, you actually can improve the bad estrogen byproducts. Because what happens when, we all have learned in biochemistry that whole cholesterol pathway that then goes to estrogen, and then estrogen gets converted to testosterone. The last thing they need is too much estrogen that gets converted to testosterone, because that's what's affecting, that hair loss on the scalp. So I tell them, think of dark red fruits and even beet. So you want to make a smoothie with beet in it, perfect. You want to have a glass of pomegranate juice, cherry juice at night, fantastic. You want to have frozen cherries, use that as your dessert at night, put a little honey or something on it. So there's a lot you can do to help your liver, in addition to fixing the rest of the GI microbiome. And many of patients with PCOS really need their GI system fixed, in addition to fixing their diet. But yeah, that helps.
Yeah, no, that's super helpful. Because we've had some people on talk about diet and PCOS, but I've actually never heard such an emphasis on the liver detox side of things, which, I mean, it makes sense in terms of estrogen metabolism.
Absolutely,
Yeah.
hormonal pathway, yeah.
Uh,
And then there are, supplements that come to mind. Chromium is really, really important. And again, chromium's role in sugar metabolism is becoming more and more noticeable. So that's a good one. Inositol is another kind of, again, supplements that, some food may or may not have more. But I usually just even focus on healthy protein, healthy fat, good complex fiber, I call it. I try to distinguish between complex carb and, because people say, oh, but I was told low carb. I'm like, okay, well, fiber essentially is a complex carb, but yeah, so they could really benefit from a good diet.
I know you mentioned you try to stay away from medications with, all patients, and even if they're on medications, trying to functionally treat or utilize functional medicine to treat them without medications is very important. But what is the role of something like metformin to jumpstart someone's recovery, get them to a position where they can probably get off of medication sooner? Have you ever evaluated that or utilized that in your practice?
Oh, absolutely. No, again, and that's why I think the hemoglobin A1C is a good guide. So if I have somebody, their A1C is over 7, 7.5, close to 8, no question, no question. It's almost like if somebody has pneumonia, I'm not going to mess with the pneumonia, right? You need antibiotics. Okay, you got to go on antibiotics. And then we will make sure you get your, vitamin C and you boost your immune system, because I know you're going to get off that antibiotics if you're not going to stay on it. But it's the same thing with metformin with PCOS. We know that doses of 1,500 to 2,000 helps that whole insulin resistance pathway. We have to break that. And we, a lot of times, start patients on that. And then as they are getting better, maybe guide them through lifestyle modification and changes. So maybe, hopefully, at some point they get off of it. There is also another medication called letrozole that also has been used in PCOS. But yeah, metformin has been huge. The newer trend is, of course, using the GLP category of medication because it does obviously address the whole sugar insulin pathway. And I am not aware of any studies that have actually compared metformin to GLPs as it relates to PCOS. But I've had patients who have tried and they have lost weight, their metabolic syndrome has improved. There were actually two patients I recall that they felt that their cycles became more regular. So I think we will probably see some studies sooner than later about how GLPs could potentially help.
And what about spironolactone?
Yeah, absolutely. So again, when it comes to the androgen excess symptoms, spironolactone is fantastic because it helps them with the acne and maybe possibly even with a little bit of the hirsute. And again, as it relates to hair loss, the alopecia, you're the expert and you know
Yeah.
how best to help patients.
Yeah,
with
no,
that.
I find it to be effective. I think for me, if I know someone has PCOS or kind of some androgen excess, it makes me favor doing spironolactone over, other medications like oral minoxidil or something like that. In terms of PCOS, did you have other questions? I want to have time. I just wanted to ask you, I know those were the main things we wanted to focus on. But I did want to just ask you about, we touched on it a little bit, but like testosterone replacement or any
Mhm.
kind of like androgens. I know some of my patients will come in and they're on like a DHEA supplement or something
Mm,
like that.
yeah.
Do you recommend those in any cases? Um,
Yeah, there are definitely, and again, I always individualize. I don't have anything, I don't make a main statement about everyone. So I, for example, had a gentleman who came to me, severe fatigue. His wife was complaining that he's depressed, he doesn't sleep, he's been gaining weight. So again, we did the whole complete hormone test, thyroid, testosterone, everything. Now, healthy testosterone for men, again, it changes based on age group, but let's say in the 50 to 65, 70 age group, I consider it between 4 to 800. In younger men,
mhm,
I would say it should be more, between 600 to 1,000 or more. So anything really less than 200 is low. So it's kind of abnormally low.
mhm,
Um, but if I have somebody with a testosterone of 6 or 800 and they want testosterone supplements, I'm like, you know what, you don't really need it. And if you in that range supplement with testosterone, you're going to cut off your own drive, that access that regulates your own testosterone production. You're going to affect that. So I don't think it's a good idea. But in the case of this gentleman, his testosterone came back 80, which is really low.
mhm,
Sure enough, I pursued that. Ended up getting an MRI of the pituitary, and he had an adenoma. So pituitary adenoma can cause low testosterone production, and interestingly, his TSH was also affected because pituitary adenoma, if it gets to be a certain size, it also can affect your vision. It sits very close to that optic chiasm. So once we brought this up, he's like, yeah, I had noticed my peripheral vision was affected. So thankfully we were able to, get him to, the neuro team. And, but in any case, he has been able to remain healthy and safe on testosterone supplementation. And in fact, his pituitary adenoma has gotten smaller. So the surgeon has held off on doing any surgery, and testosterone for him has been great. I have men who come in with testosterone of, in the low 200, 2 to 300, they definitely need supplementation. But again, if I really have someone, in the upper 6, 7, 800, and they want supplementation, I truly believe that you're going to suppress your own production. And I don't think that's a good idea.
Yeah, no, that makes sense. I'm always very cautious of any androgens just because the people with patterned hair loss are just so sensitive to even a low level of testosterone and DHT, where I see that if they have hair loss and let's say their level's super low and then they get testosterone, I've seen cases where then their hair loss worsens. So I'm obviously you have to think about the whole human holistically.
Absolutely.
But I always warn them that, obviously they have to make that choice based on symptoms and everything going on. But from a hair perspective, I'm always a little scared and cautious. But it's an area that definitely needs research. I've tried looking up literature on like testosterone levels
Right.
and rates of hair loss, and nothing really exists. So we actually might be working on something on that soon.
Nice.
We'll see. Um,
Wonderful.
but yeah, I think this was really really wonderful. I think it was so great to go over both sex hormones and thyroid, and not just go through diagnosis and medication treatment, but also really really go into lifestyle and diet. So yeah, I think um, this was wonderful. I think a lot of our listeners will really enjoy it. And we just really want to thank you for coming on.
Thank you so much for having me. It was a pleasure and wonderful talking to you all. And we look forward to working together. Okay. Thank you.
Thank you.
You can learn more about Reviva in the link below. And once again, wanted to thank Dr. Kohani for her time and for Dr. Kash and myself, Dr. Roopani. Until next time.
Thank you so much, both of you. Thanks, the team. Bye bye.